When do we start doing mammograms is the classic screening modality. So for years and years and years, it was always started at age 40. About 10 years ago, the government had their own kind of task force look into it, and they said the government recommendations were that we could start general screening on a general population if you don't have any increased risk at age 50. But the American College of OBGYNs, which are the governing body for OBGYNs, still supports doing screening mammograms at 40. What is a mammogram? A mammogram is that they're going to squeeze the breast tissue. The rumors are true. They squeeze your breast tissue and they take x-rays. So a mammogram is x-rays through the breast tissue. But we have these conflicting guidelines. So if a patient does not have a personal or strong family history of breast cancer and she doesn't want mammograms, I let her start at age 50. And instead of doing them every year, we can space them out to every other year. But my preference is that a woman gets a mammogram every year, starting at age 40 at minimum. Family history and personal history makes a big difference with all of this. So I spend a lot of time talking to my patients about a way that we can decide if they have an increased risk. They might say, well, my aunt had breast cancer and my cousin, and I don't know if that puts me at an increased risk or not. So we're always trying to figure out their risk factors. So there's something called the Tyrrell-Cuzick score, and I'm going to show it to you guys so you can Google it. Okay, it's backwards, but okay, my doctor handwriting. Okay, Tyrrell, Tyrer dash Cuzick, Cusick. But the Tyrrell-Cuzick score is a series of about 8 or 9 questions that you answer about your personal and family history, and you click enter. It tells you your risk of developing breast cancer. So it's a good starting point if we're trying to treat somebody and we don't know how concerned to be about them. Most women get mammograms once a year. The general population risk for breast cancer is 1 in 8 women. That's also 12%. So that's a good starting point too. 1 in 8 women in our country are going to get breast cancer. If you want to know if you're at an increased risk of breast cancer, you should go online and look at the Tyrrell-Cuzick score, Tyrer-Cuzick, Cusick, to see if it increased risk. If your risk falls above 20%, increased risk of 20% of breast cancer throughout your lifetime, it's recommended that you get MRIs and mammograms alternating every 6 months. If your risk is 15% or greater, then it's recommended that you get ultrasounds and mammograms every 6 months. And then if your risk is less than 15%, it's recommended just to get a mammogram once a year. So that is the Tyrrell-Cuzick score.